You know that feeling. That uncomfortable, kind of nagging feeling in your gut. We've all been there, right? Well, today, we're going to break it all down. We're talking about the most common digestive issues, what they feel like, what you can do, and, this is the big one, when it's really time to call a doctor.
Think about it this way. Your digestive system is constantly sending you messages. A little discomfort here, a strange sensation there. It's like its own language. Today, we're going to help you learn to translate that language so you can finally understand what your body's trying to tell you.
So first up is a classic that, let's be honest, many of us know all too well: heartburn. It's that fiery feeling that can creep up your chest after a meal. But what's actually going on? And how do you know if it's just a minor annoyance or something more serious?
Okay, this slide draws a really important line in the sand. On the left, you've got the typical stuff, right? That burning in your chest, maybe an acid taste in your mouth, or a pain that kind of spreads out. But look at the column on the right. This is crucial. If things aren't getting better after 2 weeks, or if you feel pain shooting to your left arm, have trouble swallowing, or see blood, those are absolute non-negotiable signs to get professional medical advice.
So what can you actually do about it? Well, here's a simple 4-step plan. First, eating smaller meals and giving your system a couple of hours to digest before you lie down, that can be a game changer. A simple trick like propping up the head of your bed can make a huge difference too. And as you're about to see, keeping a healthy weight and kicking the smoking habit are just massive for your overall gut health.
For some quick relief, you'll find a bunch of over-the-counter options at the pharmacy. This slide kind of breaks down the main categories. Here's a way to think about it. Antacids are like the firefighters. They rush in to put out the immediate blaze. H2 blockers and PPIs, on the other hand, are more like fire prevention. They actually reduce how much acid your stomach makes in the first place. They all work differently, so it's always a good idea to chat with a pharmacist or your doctor to figure out what's right for you.
All right, so we've dealt with the fire. Now let's totally switch gears and talk about the exact opposite problem. What happens when your internal traffic system gets completely, and I mean completely jammed up? Yep, we're talking about constipation. It is incredibly common, but man, it can be so uncomfortable and frustrating. So what are the signs, and what can we do to help get things moving smoothly again? And just like with heartburn, there's a really clear distinction here. You know, typical constipation might mean going less than 3 times a week, straining a lot, or having hard stools. But that column on the right, that's your guide for when it's time to bring in a professional. If there's no improvement after a week of trying things at home, if you see blood, have abdominal pain, weird weight changes, or just a sudden shift in your normal routine, all of those warrant a conversation with your doctor. Here's your proactive plan to get ahead of it. The foundation is all about diet, right? Fiber and lots of water are absolutely key. Getting regular exercise literally helps stimulate your gut to get things moving. A couple of other pro tips. Warm liquids in the morning can really help, and for some people, cutting back on caffeine makes a difference. And finally, something called bowel training. Basically, trying to go at the same time each day can help your body find a predictable rhythm. Now, when those lifestyle changes just aren't cutting it, there are different types of laxatives out there. This slide gives you the main categories. Bulk-forming ones act like a sponge, soaking up water to make things softer. Osmotic ones draw more water into your colon. Stimulants, well, they stimulate the intestines to speed things up. And lubricants, emollients, or stool softeners basically make everything a bit more slippery and easier to pass. Just remember, this is just to make you aware of the options, not for self-diagnosis. So, we've talked about the burn, and we've talked about the traffic jam. But sometimes, gut issues aren't that simple. They can be this confusing mix of symptoms that come and go, and it feels impossible to figure out what's really going on. And that brings us to irritable bowel syndrome, or IBS. Now, this is a much more complex condition, often just described as having a sensitive gut. It's not one single symptom, but a whole collection of them that can really mess with your daily life. The key thing to get about IBS is just how much it can vary. One day it might be abdominal pain and bloating, and it can swing from constipation to diarrhea. And that's exactly why this when to call a doctor column is so important here. If you're over 45 and these are new symptoms, or you're losing weight without trying, seeing blood, getting woken up at night by symptoms, or have a family history of colon cancer, you absolutely have to see a doctor to rule out other, more serious conditions. Managing IBS is often about managing your lifestyle. This slide really highlights the key strategies. Becoming a detective and figuring out your personal trigger foods is a huge one. And hey, look what's back. Smaller portions, managing stress, avoiding smoking. Are you seeing a pattern here? These core healthy habits have such a massive impact on our digestive well-being, no matter what's going on.
We've covered a lot of ground, from the top of the stomach all the way down. So let's pull everything together into one simple, universal action plan for a happier, healthier gut.
Think of this as your universal gut health checklist. Seriously, whatever specific issue you might be dealing with, these habits are your foundation. Manage your stress, drink your water, get enough fiber, move your body, don't smoke, and eat regular, reasonably sized meals. And finally, pay attention to your personal trigger foods. These 7 steps, they're the real cornerstone of good digestive health.
If you take just one thing away from all this today, let it be this. Your body knows what it's doing. Your job is to listen to it. Learning to tell the difference between a little temporary discomfort and symptoms that are persistent or alarming, that is the most powerful thing you can do for your health. Please don't ignore those signals.
So, let's end right here with this question. It doesn't have to be some massive life overhaul. Maybe it's just drinking 1 extra glass of water today. Maybe it's taking a 10-minute walk after dinner. Or maybe, just maybe, it's finally making that appointment to talk about a symptom you've been pushing to the back of your mind. What's the one small, positive step you can take, starting right now?